Hello everybody. I just wanted to take a few minutes to make a quick video and talk about how I'm feeling since I had my surgery 2 weeks ago. It's Saturday. I had my surgery 2 weeks ago on Wednesday, so I'm 2 weeks and a few days post-op. I had made, I think, a post-op day 1 and a post-op day 2 video. If you want to go and watch those, I can link them in the description, and you can get a real feel for kind of exactly how I was feeling and looking right after surgery. It's kind of funny for me to look back and watch because I'm just so groggy from the medications, and I wanted to make some videos kind of going on, but I actually had a really hard time the first week after surgery. I just had, it felt like anything that could, any symptom that could be coming up post-op, it's like I had any, post-op complication kind of thing I felt like I had, other than an infection. Thank goodness I didn't get an infection. Anyway, if you see from those first videos, I had a real difficult time waking up in post-anesthetic recovery, PAR, that's what we call it here. I'm sure there's other names, but the room that they take you to recover right after you come out of the operating room, when they kind of monitor you and check your vital signs. I had a really hard time waking up. I was in there for quite a while, and then when I came out, I had a difficult time urinating, and I went to the Airbnb that we're staying at with my husband and was trying so hard to go to the bathroom to urinate for the first, I don't know, like 12, 14 hours, I think it was, maybe. And it was just tiny bits coming out, and then eventually I couldn't get anything to come out. And I started like panicking because... Really? Really? Aspen! Aspen, people can walk by the house. Bark if they're like coming in the house, not walking by. Sorry about that. Okay, so I started freaking out because I was like, oh, I'm on these pain meds and I'm still so out of it. What if my bladder is really full and I don't know because I can't feel it? And I was like, I gotta go to the hospital and I'm so uncomfortable. And I was getting, I think my bladder was getting full and I was getting more pain in my surgical area as well because my bladder was full and everything was inflamed. So I had to go to the emergency room, and then they just put in a urinary catheter for me. So like the tube that goes into your bladder to drain it connects to a bag. And they said keep that in for 24 to 48 hours. It's just from the anesthetic, and some people have difficulty, it takes time for it to clear out of your system for your everything to kind of start working properly again. So anyway, that was the day that we were driving home. So I had a leg bag attached to my leg with my urine draining in the car. And it was funny because we just pulled over in like kind of like a bush area, like maybe where you would like get out of the car if you had to emergency stop, go pee. I'm just like hang my leg out of the car and drain it. Oh my gosh, it was so funny, but I was so sore and so out of it. It was kind of actually nice to have that and not have to make a bunch of like stops in gas station bathrooms and stuff. Anyway, we got home, and thank goodness my husband's a nurse as well as I am, so I basically just let him take care of me. Like I was like, I don't feel good, this is not good. He set his alarm at night excuse me, to wake me up, to medicate me like every 4 hours. He was giving me anti-nausea medication and pain medication, and I just slept for days, and he would like, bring me water with a straw and vegetable soup broth and like anything else that I wanted or could take. So anyway, that was that, and then I pulled out I removed it myself, which I don't necessarily recommend you do unless you've been given instructions and that's been told okay for you to do. The only reason I did it myself is because I know how to deflate the balloon and how to remove it safely and properly, and I didn't want to go to the hospital where I work and have somebody that I work with and that I know remove it for me. I also had difficulty getting my bowels going again. I was taking so much stool softener and laxative, and I didn't have a bowel movement for probably like 8 days after, and it was really uncomfortable and really stressful. Oh my goodness, I feel bad for people that are chronically constipated. So that got going again, and then finally that was better. And then after my bowels started going and I could feel like I could eat regularly again, then I started feeling better. So for that first week, it was just really rough with pain, my bowels, my bladder, everything, nausea, you name it. So after about a week, I started really cutting back my pain medication and just using Tylenol and ibuprofen, because it can be constipating to take pain medication, but I also didn't want to be in pain. And I was really bloated, like my stomach was just, oh my gosh, I looked like I was so pregnant. It was awful. So anyway, like I said, after a week I started feeling better, and at 2 weeks I basically feel back to normal. I did do a strenuous hike the other day though. It was like a 3-hour strenuous hike with my husband and a couple friends. We weren't thinking it was going to be a strenuous hike, but it was, and I got a little bit sore just because I hadn't been moving for so long. But prior to my surgery I got sick, so I was in bed sick for a couple weeks, and then I got better, and I had like a week in between my surgery where I was sick and had my surgery. So really I had been in bed and not doing anything for weeks. So it I think I just got sore because of that. Anyway, my stomach feels good. I don't have any more bruising on my abdomen. I did have some bruising and some tenderness. Oh, I also had my left ovary was, a suture was sutured around it, and then it was up through my abdomen, the suture or the stitch, to hold my dog's it was around my ovary and up through my abdomen, not my ovary, but the stitch to hold my ovary towards the front of my abdomen, because she had to cut out endometriosis behind it, and she didn't want my ovary to adhere and heal and fused to the rest of my peritoneum, like the inside of my abdomen. So I had to get that pulled out after a week, and that felt really weird. When it was pulled out, it was just, you're supposed to like cut the loop and then pull really fast towards the ceiling, and it felt so weird. I swear I could feel my ovary just go like clunk, and that was really the last painful thing, like having that in there. I felt like I couldn't stand up straight, and I just wanted to do it so bad. And in terms of what she excised, there was some spots on my peritoneum, behind my ovaries, and none on my uterus or anywhere else that she could really see. It was mostly just in my peritoneum. So yeah, she said she cut it all, she got it all, and she gave me pictures of the from the laparoscopic surgery, and pointed out where it was and where she cut it out. And it was really neat. If you want to see more if you want to see photos or me to go in more depth about the actual laparoscopic surgery, I can do that, but this one I just kind of wanted to talk a little bit about my experience. My incisions are healed up. I'm probably going to start using some bio oil now and hopefully reduce the scars. I have 1, 2, 3, 4, 5, and a couple little hole marks. Oh no, just 4. 1, 2, 3, 4, yeah, and then the 5th one is just like a couple of hole marks where the suture was. I'll insert a little clip of me showing you my incisions. So all in all, you know, it was difficult. It was a lot more difficult recovery than I thought it was going to be. You know, laparoscopic surgery is very minimally invasive, but it was a little bit more difficult recovery than I thought it was going to be. Just in that first week, really. So anyway, if you're having a laparoscopic surgery for endometriosis, I hope that you found helpful. And if you do have some of those complications that I had, hopefully you'll feel better knowing that you're not the only one. And those things are actually quite common, like the urinary retention after post-anesthesia. The bowels, taking time for your bowels to get going is really common, because when they're doing laparoscopic surgery, they don't want your bowels like moving around and full, so they really paralyze everything. And it can take time for everything to kind of wake back up and start functioning again. So yeah, don't let these things scare you. Some people have a really, really easy time and have no complications and feel great, and other people do have some things. So I just wanted to share my experience, and maybe it will help you with your future surgery. Okay, thanks for watching.